Nervous system, central and peripheral. Central nervous system, brain and spinal cord. Peripheral nervous system, autonomic and somatic. Autonomic nervous system, sympathetic and parasympathetic. Somatic nervous system, sensory and motor. Neuron, cell body, axons, dendrites, myelin sheath. Glia, astrocytes, oligodendrocytes, microglia. Astrocytes support and repair neurons. Oligodendrocytes create myelin sheath in CNS. Microglia, phagocytes. Gray matter, numerous cell bodies with a few myelinated axons. White matter, few cell bodies and numerous myelinated axons. Cerebrum, complex functions. Brainstem, basic human physiology. Meninges of brain and spinal cord, duramater, arachnoid, subarachnoid space, p-mater. Subarachnoid space contains CSF. Frontal lobe, cognition and voluntary movement. Parietal lobe, processes sensory information. Temporal lobe, process memories, integrating them with sensations. Occipital lobe, vision. Efferent neurons, carry sensory information. Efferent neurons, carry motor information. Cranial nerves, 12 pairs arise from brain. Spinal nerves, 31 pairs arise from sides of spinal cord. Autonomic nervous system axon, cardiac muscle, smooth muscle and glands. Sympathetic ANS, fight or flight. Parasympathetic ANS, rest and digest. Increased intracranial pressure, abnormal increase in intracranial pressure due to cerebral edema or obstruction resorption of CSF. Cerebral edema, increased fluid in brain cells or between them, in most cases both vasogenic and cytotoxic. Vasogenic edema, cerebral edema due to disruption of blood-brain barrier with increased vascular permeability. Cytotoxic edema, cerebral edema due to intracellular fluid accumulation by brain cell injury. Hydrocephalus, accumulation of excess CSF causing increased intracranial pressure. Hydrocephalus can result from obstructed flow of CSF, impaired resorption of CSF. Normal pressure hydrocephalus. Pressure remains normal, symptoms mimic MS, Parkinsonism, and other degenerative brain disorders. Brain herniation. Brain pushes out due to brain edema, intracranial tumor and hemorrhage. Arnold-Chiari malformation. Brainstem and cerebellum extends into spinal canal. Congenital hydrocephalus. Stenosis of the cerebral aqueduct. Microcephaly. Abnormally small skull and brain due to alcohol syndrome, congenital viral infection, etc. Cerebral palsy. Permanent, non-progressive motor problems due to abnormal brain development before birth, spasticity, dyskinesia and/or ataxia. Epilepsy. Paroxysmal transient disorders of brain function due to abnormal electrical discharge in cerebral cortex. Epilepsy often associated with loss of consciousness, sensory mental disturbance, abnormal motor activity. Direct CNS trauma, contact between an object and the brain spinal cord. Indirect CNS trauma, transmission of kinetic energy causes brain movement and damage within the skull. CNS fracture can damage brain structures. CNS parenchymal injury, functional disorders or death. CNS vascular injury, intracranial hemorrhage, intraparenchymal or extraparenchymal. Intraparenchymal hemorrhage, within the tissue of the brain. Extraparenchymal hemorrhage, on the surface of the brain. Spinal cord injury, usually due to severe neck extension or flexion. Shallow water diving accidents, falls, car accidents can cause paralysis. Paraplegia, paralysis of lower limbs. Quadriplegia, paralysis of all four extremities. Concussion, temporary brain dysfunction following head injury. Repeated blows can lead to chronic brain disorders including dementia or Parkinson's disease. Contusion, superficial bleeding. Coup and counter-coup injury. Coup injury, injury directly below site of blow. Contra-coup injury, damage to the brain on the side opposite the coup injury. Laceration, bullets and knives that penetrate the brain. Bleeding can create hematoma. Epidural hematoma, fast between skull and dura mater, almost always accompanied with skull fracture and injury in arteries. Subdural hematoma, slow between dura and arachnoid due to venous bleeding from falls, car accidents, athletic injuries and shaken baby syndrome.